Welcome to Lecture 29, where we're going to take a look at the training adaptations that affect VO2 max and the cardiovascular system. Up until now, we have only discussed, at least mainly, I guess the exception is heat acclimation, but we've mainly discussed the acute responses to an exercise bout. That is, what happens to the metabolic systems, the cardiovascular system, the respiratory system in a single exercise bout. So from here on out, though, at least in this chapter, we're going to look at what are the long-term changes, the adaptations that take place with a prolonged program of endurance training. Before we get down into the heart of the material, I want to bring your attention to a point that our textbook makes. And this is in the second paragraph of chapter 13. And that is, when we're talking about VO2 max, it seems to be closely linked to the ability of the cardiovascular system to deliver enough oxygen to the exercising muscles. And so the maximum cardiac output greatly determines VO2 max. Conversely, when we're talking about endurance performance, this has to do more with a sustained effort that is, of course, submaximal over some prolonged period, right? And in that case, it's the biochemical properties of the muscle that seem to be more important. And so our textbook will look at those two things separately. So we'll first start with mostly VO2 max and cardiovascular. Then we'll move into, starting in the next lecture, the muscle adaptations that take place that will then more affect endurance performance. The first topic I'll cover is the first section in Chapter 13, and that is the principles of training. These are the principles that are going to dictate what kind of adaptations and to what degree your exercise training will have. The first one is this concept of overload, often called progressive overload. And this is the idea that an organ system or a tissue has to be exercised at a level beyond which it is accustomed to get any adaptations. For example, if I am a relatively sedentary person and I decide I'm going to start improving my ability to do push-ups, I might find that I can push out 20 push-ups one day. And I'm just going to keep doing that day after day after day. I do 20 push-ups. Well, might be really hard the first day, and the second day it might be a little sore, and it's still really hard. But maybe by the fifth day, it starts getting a little easier. And by the 8th or 10th day, it's a piece of cake. I can just whip out 20 push-ups without even thinking about it, and now it's pretty easy. I could continue to do that day after day after day for years, but that 20 push-ups would never then get any easier because I had reached a plateau. So the progressive overload part of it was that you keep having to do the overload. Now I'm accustomed to doing 20 push-ups a day, so now it's fairly easy. So to improve my push-up performance, I'm going to have to do the overload part of it, which is now maybe push it up to 30, and then 40, and then 50, etc. The factors or the variables that help define overload are intensity, duration, and the frequency. So the intensity of exercise will be the percentage of your effort. Now we can switch to, say, running. You can run at a 50% VO2 max, or 60%, or 80%. And so the intensity at which you run will then dictate the overload. Next one is duration. This clearly would be the amount of time you spend. The longer the duration in general, the greater your adaptation, or the greater the overload. And then frequency, either number of days per week or even number of workouts per day if you do more than one per day. And so to achieve an overload, you can increase the intensity, you can increase the duration, or you can increase the frequency. The second principle of training is reversibility. And this, of course, is the opposite of overload. And that is, if you stop doing your exercise training, then any gains you have made, of course, will be reversed. The third principle is specificity. And this is the idea that any training effects that you will have will only be confined to the muscles that were active and also be related to the types of activities you are doing. So, for example, obviously, if you're doing a running program, you're not going to see much adaptation in your arms. If you're only doing sprint training, it may not affect your endurance performance all that much, although it still might a little bit. I guess the reverse of that would be more true. If you're doing just an endurance program, your sprinting performance will not increase. In the next section of the textbook, it talks about training and VO2 max and a little bit of the factors involved. The main point here is that genetics plays a large role in setting our VO2 max. Maybe 50% of your VO2 max is determined by your genetics. There's also a large genetic component into how well we respond to training. Some people will start endurance training programs and show hardly any gains at all, while some will show gains up to 50% in their VO2 max values. Most people will have about a 15 to 20% increase in VO2 max after 2 to 3 months of training. Table 13.1, which is shown here, gives us some VO2 max values for some both healthy and diseased populations, and some of these values we're pretty familiar with. So cross-country skiers and distance runners in the sports world will have the highest VO2 max values, at least the ones that are highly trained and world-class athletes, which are the values shown here. Distance runners, 83, cross-country skiers, 84. There have been values even above 90 that have been recorded in males. Females, 62 for distance runners is probably a little low. That would not be quite world-class, but at least in the low 70s, if not upper 70s for females. Sedentary young people, 45 for males, 38 females, and then as we age, it'll get a little bit less, mostly because we become more sedentary, and so maybe near the low 30s. Diseased patients will see very, very low VO2 max values. Heart attack patients, post-myocardial infarction, around 20, and then pulmonary diseases, maybe even in your mid to low teens. Those would be quite debilitating numbers, and people would have a difficult time even negotiating walking. So now let's move to the next section of the textbook, which considers why exercise training improves VO2 max. So first, let's take a look at an equation we're familiar with, and that's the Fick equation, that tells us that VO2 max equals the maximum cardiac output times the maximum AVO2 difference. If we break that down, it should make perfect sense, right? Because your maximum cardiac output represents the delivery of oxygen to the muscles, and then your max AVO2 difference will be the extraction and use of oxygen by the active muscle tissue. So if you maximize both of those, you should be able to maximize your VO2 max. In the first point here, I point out that an increase in VO2 max then must be the result of an increase in cardiac output or an increase in your max AVO2 difference or some combination of both. It turns out it's the latter. Of course, both of them will increase, and those will have an effect on your VO2 max. And the second point is that, and this is one we already know, endurance training does not increase your maximum heart rate. In fact, it actually decreases slightly. And so any increase in your maximum cardiac output is, of course, due entirely to an increase in stroke volume. So first, let's look at the time course of some of these changes, and then we'll look at the specific details. We'll start with figure 13.1, which shows us the percent improvement in cardiac output, AVO2 difference, and VO2 max values after 4, and then again later after 32 months of training, and were originally sedentary subjects. We can see that after 4 months of training, VO2 max increased just above 25%, which is shown in the purple bar. And this was entirely due to an increase in the maximum cardiac output of 10% or so. Notice there is no, or at least very minimal, change in the maximum AVO2 difference. However, after 32 months, we see another 17% increase, 16% increase in VO2 max. But this was accompanied by only an additional 5% in the maximum cardiac output. This time, the major difference came in the maximum AVO2 difference, which is a 25% increase. So a bit of a time course difference here. So from these results, it is apparent that at least the early adaptations and the early increases in VO2 max are driven by mainly cardiovascular adaptations, that is probably in the heart, and later on, as VO2 max continues to increase, those changes are driven entirely, or almost entirely, by changes in the AVO2 difference, or the ability of the muscles to extract more oxygen. So what are these mechanisms that serve to increase a cardiac output or to increase your max AVO2 difference? That will be in the next two sections of this lecture. Let's first take the change in maximum cardiac output, and again, we know this is entirely due to changes in stroke volume because there is no or only a very small change in heart rate, and it actually goes down rather than up. So we'll use figure 13.2 as our reference to discuss the mechanisms that will increase maximum stroke volume. So looking at the top of the figure, we see, of course, the endpoint here is an increase in stroke volume. How does that occur? Well, we already know from our cardiovascular chapter what are the factors that increase or control or regulate stroke volume. Well, one of them is the end diastolic volume, or the preload. The other is contractility, and the other is afterload, or your peripheral resistance. So let's take a look at how those change after a period of endurance training, maybe several weeks or at least several months. The main reason that your end diastolic volume or your preload will increase after endurance training is because of an increase in plasma volume. We've seen before, we showed an increase in 7 to 10 or 12% of plasma volume. That just means you have enhanced your venous return, and the heart will fill up a little bit more between each beat. The second reason is that we actually do get an increase in ventricular volume. That is, the size of the chamber increases. Your right atrium will increase, left atrium and left ventricle, but it's, of course, it's the ventricle that we're worried about here. Left ventricular volume will increase after a period of exercise training, meaning simply it can hold more blood. And if it can hold more blood, it can pump more blood. And the third factor that will help increase our preload, or the end diastolic volume, shown right here in the middle, filling time and venous return. This occurs both at rest and during exercise. And what we mean by that, increased filling time, means there's more time in between each beat for the heart to fill up. Well, that's because we have a lower heart rate. So with a lower heart rate, we can have a greater end diastolic volume, which then can achieve a higher stroke volume. And again, that will occur from rest at all power outputs all the way up until max. The second main mechanism that increases stroke volume is going to be contractility. And this is simply the force of the cardiac contraction. And indeed, long-term endurance training does increase the cardiac mechanics. That is, it creates a more forceful contraction, probably due to increased muscle mass. And our book indicates that there is an improved left ventricular twist mechanics, and that is simply means as the heart contracts, it actually does twist a little bit as it ejects blood from the bottom of the ventricle up to the top and out the valve. And so that's what that means. The final factor that will impact stroke volume is total peripheral resistance, or the afterload. And after a period of endurance training, one of the adaptations is that there will be less sympathetic vasoconstriction on arterioles, and so your overall resistance is going to go down a little bit. And so that will enhance the ejection of blood into the aorta. So all of these adaptations will serve to increase stroke volume and therefore maximum cardiac output after a period of endurance training. So finally, for the last section of this lecture, let's take a look at the mechanisms that will help increase AVO2 difference, or the extraction of O2 from the blood. And I'll do this by looking at figure 13.3. This entire figure shows both the increases in maximal cardiac output and a VO2 difference that then contribute to a VO2 max at the top of the figure. We'll be concentrating looking at just a VO2 difference right now on the right side of the figure. The most important factor that contributes to the increased AVO2 difference after several months of endurance training is shown in this box on the right. And this would be, the main one here would be your increase in capillaries, or what we call capillary density. So there would be more capillaries per, say, millimeter of tissue. This has several important effects. The first one is that now the muscle fibers are surrounded by more capillaries, means that the distance from capillary to mitochondria is less for the diffusion of oxygen, so it decreases the diffusion distance. And the second major and important factor that increasing capillarity does is it slows down the blood flow. So there's more volume, right, of blood inside this capillary bed now. So if there's an increase in blood volume, it can flow slower. And so the transit time of those red blood cells going through the capillaries now is longer. The duration is greater. And so that gives more time to unload oxygen and deliver it to the muscle fibers. The other main factor in that box is, of course, an increase in mitochondria that occurs with endurance training. And since they serve as the sink for oxygen consumption, that is the organelle that's actually using the oxygen. And what is it doing? It's reducing oxygen right into water. More mitochondria means you can use more oxygen. The other factor that contributes to the increased AVO2 difference is this box here on the left, and that's the increase in muscle blood flow. It's not really discussed in this section of the book, but the point here is that as we go through exercise training, we get better at redistributing blood flow to the active tissues and have less flow to the inactive tissues. We talked about that with the article on the leg blood flow, and typically we're really good at shunting blood away from, say, the splanchnic organs, the abdominal organs, into the active muscle. That alone will help increase AVO2 difference because now we're sending more blood to the active tissues that are actively increasing their oxygen extraction, with less blood going to the tissues that won't use as much. And so overall, this just creates a greater chance to use oxygen. So to summarize this lecture, we can also do that with the same figure, 13.3. So the increase in VO2 max, which is shown here at the top, is of course due to an increase in your cardiac output and an increase in your AVO2 difference. The increased cardiac output, we know, was generated by an increase in stroke volume because heart rate doesn't change much, and that's primarily due to an increase in preload or the end diastolic volume with perhaps a reduced afterload, and then not shown here, but we know also an increase in contractility. And the AVO2 difference, of course, mainly due to capillaries and mitochondria. So that shows us the factors involved in increasing our VO2 max with training. So that concludes our lecture 29, and that was pages 293 to 299.